I'm Dr. Ellithorpe. I am the founder and owner of Tustin Longevity Center in Tustin, California, Southern California. And I have been involved with chelation therapy all my life. My father saw that chelation was being done in the Great Lakes area back in the 1960s, early 1960s, and my grandfather had severe angina. And back then there was no stent or open heart surgery, so my father arranged for my grandfather to get chelation therapy then, and he went through a course of 40 IV treatments, and I was only 7 years old, and I saw my grandfather, who had resting angina, so it was unstable, lived long enough to see me go to medical school as a result of chelation therapy, and he did a maintenance all the time, at least about 10 times a year. He did it the rest of his life. So I'm very familiar with chelation therapy. In fact, Dr. Ray Evers, who brought chelation therapy to the United States Congress to authorize and argue the point that we have off-label use, we're training, our training as physicians enabled us to decide the off-label use of things. So EDTA was granted, and all off-label use was granted to physicians through Dr. Ray Evers, who I greatly respect and was my personal physician, and one of the reasons why he inspired me to go on to medical school. So you can see, ever since I was a little child, I've been around the treatment of chelation therapy to its present form. I use it on all my patients. I try and get all my patients to use chelation therapy because I understand that heavy metal toxicities are involved in all endothelial lining of the blood vessel damage and other tissues of your body. So these free radical heavy metals have to be reduced. I like living in the 21st century. I like flying here and not taking a wagon out here. And so there is going to be some degree of technology price to pay. And that price is handled with chelation therapy by removing some of the free radical heavy metal toxic waste that is generated in our industry, in our computers, in our battery formation. So everyone needs to learn about chelation. And we physicians are taught about this environmental impact of heavy metals and toxicants through the American College for the Advancement of Medicine. It does a wonderful job in training on this, and so I recommend that every physician get a glimpse of this, because whether you're a specialist in anesthesiology or cardiology or dermatology or pediatrics or any specialty, you have to understand that your tissues need good perfusion of the tiny capillaries, and if the microvasculature damage to your area of your specialty can be improved with chelation therapy. Example, I have a lot of ophthalmologists who ask how I improve my macular degeneration on my patients, or optic neuritis patients, and I use chelation therapy, even glaucoma patients, and just the improved microcirculation from chelation on these patients resulted in less need for surgical intervention on the eye. So all specialties would be greatly advantaged if you would come to one ACAM training to get a grip on how this microcirculation history of chelation therapy helps. So all patients need it. All practicing clinicians need to attend ACAM to understand the mechanism and safety. This is so safe. I'm 66 years old, and I think I was about 7 when my grandfather started getting chelated. So I have about 58 years of personal experience with EDTA chelation. It is so safe. I can honestly say I've had no significant even side effect that was not good on my patients. It is such a safe practice. Hundreds of thousands of millions of treatments worldwide over the past 60 years certainly is a very safe thing to use. So EDTA is an antioxidant. Chelation therapy helps with this chelation of oxidizing free radicals out of your body. but the EDTA molecule itself helps with the endothelial vasodilation for better perfusion and flow dynamics. I can't imagine why a doctor would not want to understand how to employ this in his therapy as well. So I only have great things to say about the American College for the Advancement of Medicine for the benefit to the patient, and I myself use it. I do a maintenance of once a month chelation. I must have had 200-300 chelations already in my lifetime. So I think that's my story.